So I am going to show here a spherophakia case in which what we used to do and what we do now. This is a case of spherophakia, and what we do now is this. In times in the past, what we had to do is to make a capsulorhexis out of this spherophakia, and that was the most difficult part of it. Today, what we have is the femtosecond laser, and what we do is in these challenging cases, we do spherophakia in these challenging cases with the femtosecond laser. The femtosecond laser gives us the possibility of having the spherophakic bag very nicely there, and it has done the capsulorhexis, and the capsulorhexis is the most important part of the spherophakic bag. These capsulorhexis once done, it gives a great advantage to the whole capsular bag. And then what we need to do is to have the CTR in. The CTR comes in, but here in the spherophakic bag, do you need a CTR at all? What you do need is no CTR. And what you do need is the intraocular lens in the bag. The intraocular lens in the bag can go in. In this case, we place in the CTR, and the CTR once going in has come in. Now, in this case, it is also a patient who has an iris that is totally translucent. And this iris has a great problem. The patient cannot see well because of the albinism and the albinotic iris. So what we need to do is to place in this iris reconstruction ring. But the iris reconstruction rings are not all that simple. And here, when I place the first iris reconstruction ring, it goes in very well. But what we have now is this. Now, the second iris reconstruction ring, when it was to be placed, it broke. And when it broke, now what do we do? This has a jagged edge. If I put this jagged edge inside, then what may happen? Yes, what may happen is I might puncture the bag of the intraocular lens, of the capsular bag. So I'm gingerly looking at it and trying to place it in. One try, and I feel it has impinged on the bag. Another try, and I still think that it is not going too well. But placing in high molecular weight viscoelastic, prayers, and then gradually tweezing it in so that it does not rotate to that extent. Both the ends, remember, are jagged, and we could lose the whole bag, the CTR, and the intraocular lens, and land up in one of those situations that Dr. Mahipal showed. But we are the Chennai capsules. We know what to be done, how to be done, and this is the way that it has to be done. So the intraocular lens is there, so CTR is there, and the iris reconstruction ring is there. So all there, and remember, two of the flanges had come off. So what we have done is positioned inferiorly all the full flanges, and this is the eye post-operatively, this albinotic eye, without a problem of the photophobia. Thank you very much.